Hello, I'm Dr. Alancia Wynn. Welcome to Health Chat. So today we're going to be talking about men's health. So if there are any men in your life, your husband, father, brother, cousin, that you feel like needs to hear this information, go grab them. This will be a good time. So we're going to start off by talking about the prostate. So what is the prostate? Well, first of all, let me just show you a picture. So what the prostate is, it's a gland that men have. It's about the size of a walnut typically, so probably about that big or so. And it sits right under the bladder. So if you can see here, this is your bladder there, and that's the urethra that drains the urine out of the bladder through the penis. And then this here is the prostate. So it sits kind of right underneath the bladder. So that's where it is. So what does it do? Primarily, it produces part of the fluid that makes up the semen. Now, there are several things that can go wrong with the prostate, and that's what we're going to start off by talking about. So the first thing we're going to talk about is something called prostatitis. Now, what that is, it's an infection or an inflammation of the prostate gland. And a lot of times it is infectious. Sometimes it can be caused by a bacteria. Sometimes it can be caused by a virus. Sometimes it can be caused by some of the same conditions that are sexually transmitted, things like syphilis, chlamydia, gonorrhea, things like that. But a lot of times it can be the same bacteria that you might see in a urinary tract infection. So what are the symptoms of prostatitis? The most common symptom is pain. It can be pain constantly. It can be just pain or burning when you urinate. Sometimes men have the sensation that they have to urinate frequently, but then when they go, they don't have any urine that comes out. And usually it's a sudden onset of symptoms. Sometimes they can have some back pain. Sometimes there can be some fever. Sometimes there can be some just kind of general fatigue, achiness, things like that. So the way it is diagnosed is you have to go see your doctor. I know men don't like to go see the doctor, but you have to go see your doctor to get checked out. What they will do typically is they'll do a urine test to see if this is a urinary tract infection, because a lot of the symptoms are the same as if you had a urinary tract infection or a bladder infection. So if they rule that out, then the next thing is they would check the prostate itself. And what a doctor does when they check your prostate is they put a gloved finger inside your rectum to check the prostate. And a lot of times when they do that, if you have prostatitis, it can feel inflamed. It can be very tender to you when the doctor is examining you. And that's a way that they can determine that it is prostatitis. And that also is a way to check to make sure that it's not any of the other conditions that we'll be talking about a little bit later. So once the doctor determines that it's prostatitis, the treatment is an antibiotic, since most of the causes are bacterial. Like I said, sometimes it can be caused by viral or other things, but most times it's a bacterial. So the doctor will put you on an antibiotic. If you have any other symptoms, or if you have been potentially exposed to a sexually transmitted disease, that may change which antibiotic they put you on, or they may want to do some other testing as well. But most times people are treated with prostatitis, who have prostatitis are treated, and it goes away quickly without any problem. However, there are a small segment of men who their prostatitis either comes back after it's treated or it never goes away, in which case that is called chronic prostatitis. And that's a little harder to treat than the acute. A lot of times you need to be on antibiotics for an extended period of time. But sometimes you may even need to have surgery or intravenous antibiotics, which are antibiotics through an IV, to get that treated. And if they continue to treat and it's still not getting better, then they will need to look for other causes of the prostatitis. Is it a virus? Is it something else going on? But most times the prostatitis is an acute illness that's easily treated once it's diagnosed. The next thing that can go wrong with the prostate is what's called BPH, or benign prostatic hypertrophy. Hypertrophy just means enlargement. So that is very, very common, and I can show you a picture of what that looks like. So if you go back to the original picture where you see the prostate here, this is what the prostate looks like in a man who is in his 20s, maybe 30s. As men get older, the prostate enlarges for reasons we don't understand. But every man, if he lives long enough, his prostate is going to enlarge to a certain extent. So this picture is when the man's in his 20s, but this is as the man gets older and his prostate starts to enlarge. You can see the difference between this prostate and this prostate. And so what happens as it enlarges? A couple of things. Number one, you can see that urethra is now a lot thinner. It's a lot smaller, so that urine's going to have a lot harder trouble getting through that. And you can also see that it starts to push up on the bladder. You can see here that bladder edge is nice and smooth. Here it's kind of indented as that prostate gets bigger and starts to push up. And those are important because those are what causes a lot of the symptoms that come along with BPH. So you can kind of think of when the prostate gets enlarged like that, you can kind of think of it like someone standing on a garden hose. Whereas if the garden hose is flowing normally, if nothing's sitting on it, but then someone stands on it, yeah, the water is still flowing, but there's a lot less of it coming out, or you have to crank up the faucet to get the water to flow out. Same kind of thing happens with the urine. So the common symptoms for BPH are the urine starts to flow less, flow slower or less forcefully. It may take longer for you to empty your bladder. You may not be able to empty your bladder all the way, so you may go to the bathroom and then have to go back 5 or 10 minutes later because there's still urine there. Sometimes you have to get up several times at night because your bladder is irritated, because as that prostate gets bigger and starts pushing up on the bladder, that irritates the bladder. And so the bladder, not only is it not as big, so it doesn't hold urine as much as it did before, it also gets irritated. And the walls of the bladder, the muscles in the wall of the bladder, they start to get thicker and they get irritated, and so they get kind of twitchy. So they almost like they're going into spasm. It's not really a spasm, but you can kind of think of it that way, is that the muscles are just not nice and smooth, and so they just don't work as well. And so you urinate frequently, you have to get up at night to go. When you do go, the urine is not flowing as quickly as it did before, not as forcefully. You may not empty your bladder all the way. And a lot of times you have this urgency, what we call urgency, which means it's not, oh, I need to urinate. I'll go in a few minutes as soon as I finish reading this page. It's kind of this, when you feel like you have to go right away. Sometimes as it progresses, it can even cause men to start having trouble holding their urine, which means they start to have accidents, so the urine starts to leak. And again, that's because those bladder walls start to get a little twitchy and they're not as strong as they were before they got irritated by that big prostate. As I said, we don't know what causes it, but it's very, very common. And there are plenty of treatments, plenty of ways to treat it. There are some men who don't want to get treated at all. There are some men that the symptoms are not particularly bothersome, and so what we call watchful waiting, which means we just kind of keep an eye on the symptoms and don't need to do anything about them unless they progress further. And that is perfectly fine to do. There's no risk in doing that. If they get worse over time and then the man decides, okay, now I'm having to get up more, or I'm not able to sit through a meeting at work anymore, I'm ready to get treated, then you can treat them. And then there are medications that treat BPH, and there are several different medications, but they're divided kind of into two different classes of medications. One works on improving the urine flow, and one class works on shrinking the size of the prostate. So what the one that shrinks the size of the prostate does is it literally takes the size of the prostate. So instead of the prostate being this big, it shrinks it down. It's never going to shrink it back down to the size you were when you were a teenager. It's never going to go that low, but it can decrease it in size significantly so that then it's no longer pressing on that urethra, it's no longer pressing up on the bladder. So those symptoms go away because the prostate is just smaller. The downside of that is that it takes several months after you start that medication for the symptoms to go away. So it's not typically the first drug we put people on when they're starting to have symptoms, especially if the symptoms are particularly bothersome and they really want more relief quicker than what that medication will provide. We typically start them with the other type of medicine, and what that does is it just relaxes the muscles of that urethra. So again, the urethra is that space here, that tube that drains the bladder. So what it does is it just relaxes it, so it dilates. So whatever space is left, it just maximizes the space that the urine can flow through. And it relaxes the muscles of the bladder, so that twitchiness of the bladder walls, that slows down as well. So that will decrease the symptoms. So it doesn't do anything about the size of the prostate, so your prostate is still really big, but the muscles around it are more relaxed, and so that improves the urine flow. Downside to those medicines is because they dilate the vessels, they don't just dilate the urethra and the bladder, they can dilate your blood vessels, which means your blood pressure can drop, which means sometimes you can get a little lightheaded or dizzy or something like that with those kind of medications. But the benefit of it is that it does work a lot faster than the other type. And sometimes men need both. So there are certainly plenty of men who start off with one, helps a little bit, but not fully. They need to add the other one, and a lot of times the two drugs work better together than either of them alone. So it's not you replace one with the other, you just add the second one on. If it gets severe enough as it progresses, because it is a progressive condition, so it's not once the prostate enlarges, it just is one size. It just continues to enlarge over the man's lifetime. So as it gets bigger and bigger, a lot of times the drugs are not working anymore. Sometimes they don't work at all when you first start them, or sometimes they work for a while, but then as the prostate enlarges, they don't work anymore. And then you need to have surgery. There are several different types of surgery, so I'm not going to go into the different types of surgery. But there are definitely different types of surgery that sometimes you need to just go in and kind of open up that tube again to let the urine flow. Sometimes you need to remove part of the prostate if it's especially big to open up that tube. So if it gets to that point, you need to talk to the urologist, which is the surgeon that would do that type of surgery, and they would, based on how big your prostate is, what your symptoms are, what other health risks you have, they would then determine what type of surgery would work best for you. And of course, there are complications to the surgery as well. Sometimes men after the surgery have trouble holding their urine because their bladder doesn't work anymore, or that tube got too dilated. Sometimes they have some impotence, sometimes they have some numbness. So you definitely want to talk to the surgeon before the surgery and weigh the risks versus the benefits of the surgery. But it definitely works really well for a lot of men when their symptoms have gotten to that point. And again, because of the complications, that's why we don't jump right to surgery. We always try the medications first, because the risk of the medications are a lot less than the risk of surgery. And for a lot of men, the medications is all they need. Excuse me. Another thing that can go wrong with the prostate, which is a little bit more serious than the things we've talked about before, is prostate cancer. And of course, that's the thing that a lot of men are afraid of, the reason why they don't want to go to the doctor and get their prostate checked, because they're afraid that the doctor might find prostate cancer. So there are several risks for developing prostate cancer. So not every man is going to develop prostate cancer. Again, every man, if he lives long enough, he's going to develop some enlargement of the prostate, but not every man is going to develop prostate cancer. If you have any relatives who have developed prostate cancer, that increases your risk. African American men are at higher risk for reasons we don't really understand. Those are the main, and depending on your health status, the more unhealthy you are, if you have high blood pressure, diabetes, any of those, if you've had any other types of cancer, those all things will increase your risk for prostate cancer. The way the prostate cancer is diagnosed, remember back when we were talking about prostatitis initially, I talked about that exam where the doctor puts a gloved finger into your rectum and feels your prostate. That's how we diagnose prostate cancer as well. Because when we're doing the exam, if the prostate feels irregular, if there's any lumps or bumps, or if one side is bigger than the other, or if something just doesn't quite feel right, those are the things that make it more likely or more concerning that you might have prostate cancer rather than just a big prostate. Because sometimes the symptoms are, a patient will come in with the symptoms and they'll have those symptoms of BPH. I'm urinating a lot, I'm getting up at night to go, my urine flow is not as strong as it once was, and so we'll think, well, it's just BPH, and then we do the exam and then we feel something that means, well, maybe this is cancer as opposed to BPH. The other part of the diagnosis of prostate cancer is a blood test called a PSA. There's been a lot of controversy about the PSA over the last few years. Is it a good test? Is it not a good test? Should we do them? Should we not do them? It's been out in newspapers and on TV a lot, and so you may have heard some stories about that. And it's not a settled controversy yet. There's definitely flux as far as who gets a PSA and who needs one and who doesn't, but it's just one piece of the puzzle. It's not just based on this number, we say that you have prostate cancer. So it's definitely a test that we use, and so we use that in conjunction with the exam. And the way we know for sure that is prostate cancer, because we can't base it just on an exam, is you have to have what's called a biopsy, which means they go in with a little needle and they take some tissue, especially if there's an area that feels concerning or feels suspicious. They'll take some tissue samples of that, and then they'll send it off to a lab, and the lab will look at it under the microscope, and that will say whether or not it's prostate cancer, or if it's just that your prostate is growing, it's just growing irregularly or in a different way. Once it is diagnosed that it's definitely prostate cancer, there are lots of different ways that it's treated. And again, just like the surgery, there are too many options for me to go over here, but suffice to say that there are lots of different treatments. There's surgery, there's medications, there is radiation, there's chemotherapy, and the urologist, the doctor that is seeing you for the prostate cancer, is the one that will work with you to determine the best treatment for you. And there's lots of different reasons that they would choose one treatment over another. It's your general health. How healthy are you? How can you tolerate one treatment versus another? Has the cancer spread beyond the prostate? Is it in other parts of your body, or is it just in the prostate? Is it an aggressive tumor, which means it has a high risk for spreading, or is it a non-aggressive tumor? Men who develop prostate cancer later in life, in their 70s, 80s, or later, it's much more likely that they will die with it rather than from it, because those men typically develop a cancer that is not as aggressive. It's much more slow growing. It's much less likely to spread beyond the prostate. It's much less likely to cause a problem. Men who are younger who develop prostate cancer, men who are in their 40s or 30s, are much more likely to develop what we call an aggressive type, which means it is a faster growing tumor. It's much more likely to spread, and a lot of times it grows so fast that by the time we find it, it is already spread outside the prostate. Because just like any other cancer, it can spread through other parts of the body. It doesn't necessarily have to be just in the prostate. And if it's already spread, then that definitely changes the treatment options that you have. Because once it's spread, then just doing surgery is not going to be a treatment that's going to be as successful if you just have it just in your prostate, which is a reason that you need to get your prostate checked on a regular basis, because if something is developing, it's much easier to get treated if it's caught early rather than later. So if you don't see your doctor for 5 years and you develop something, and by the time you go back on year 5, it's already spread into your bones or your liver or other parts of your body, it's much harder to treat, whereas if you had gone on year 1 and caught it and it was just a little teeny tiny thing that they could just go in and remove, and then it wouldn't have spread throughout the body. So get checked every year, get checked every year. I can't stress that enough. You got to get checked every year. So how do we prevent prostate cancer, or how do you prevent prostate cancer? Well, there's really no one thing that you can do that will decrease your risk for prostate cancer. In general, it's just being healthy overall. You want to watch your weight, you don't want to smoke, you want to limit your alcohol intake, exercise regularly, and then just make sure that you're generally healthy. If you have any other health issues, make sure that they're well controlled. You know, if you have high blood pressure, diabetes, or anything like that, make sure those are well controlled as well. Another thing, so we've talked about the prostate. Now we're going to switch gears a little bit. So we're going to talk about testosterone. So what testosterone is the male hormone. So women have estrogen, men have testosterone. So just like women, as they get older, they go through menopause, their estrogen levels drop. Men, a lot of times, as they get older, their testosterone levels will drop as well. That's the number one cause of a low testosterone, is just general aging. There are certainly some medications and some treatments that can cause your testosterone level to drop as well. So the number one treatment for testosterone is just to replace the testosterone that your body is no longer producing. But you have to know that you have it, which means you have to go to your doctor. That's the trend here. Those trend here, guys. You got to go to your doctor, get checked out. So the symptoms of low testosterone are pretty vague. There's a commercial that used to run, I don't know if it's still running or not, that they used to talk about the symptoms. You're tired a lot, your sex drive is lower than it had been, you have some impotence issues. So it's pretty vague. You just kind of feel blah a little bit. And so you go to your doctor, you tell them your symptoms, they will test your testosterone. It's just a blood test, so they test it just like they would any other thing. And then if your level is low, then they can treat it. And what the treatment is, as I said, is they just give you a artificial type of testosterone. There are several different ways you can do it. You can do it as an injection, you can do it as a cream, you can do it as a gel. And then you get checked on a regular basis with blood tests to make sure that the testosterone level is coming back up to where it should be. And a lot of times you'll know because your symptoms start feeling better. Again, not going to make you feel like you're 20, so it's not a magic bullet. It's not something that, hey, my testosterone level is normal, but can you give me something to make me feel better? It doesn't work that way because there are risks for taking testosterone, so you don't want to take it if you don't need it. And the only way you know you need it, get checked by your doctor, get that level checked, and then they can treat it and then make sure that your level is appropriate. Because you also don't want your level to be too high based on the amount of the medicine you're taking, so they may adjust your dose based on those blood tests. The last thing we want to talk about is impotence. Another thing all over the TV with the ads from all the drug companies, all the different medications. What are the causes of it? A lot of times men can develop impotence just from normal aging. As the testosterone level drops, that can cause it. If you are on a lot of different medications, especially blood pressure medicines, they will cause it. Diabetes medicines can cause it, but just having high blood pressure can be a cause. Just having diabetes can be a cause. If you have any kind of circulation problems, people who have had heart attacks or any type of artery blockages, that will cause impotence as well. And the treatment, of course, is a couple different things. Number one, people always think about are the pills that you see advertised on TV all the time. Yes, that is definitely a treatment that is viable and works well for a lot of men, but you want to check for these other causes. Because I could give you all the medication in the world, but if the problem is that you have diabetes and didn't know it, then that medicine is not going to work. We need to fix the diabetes, and then the impotence may get better on its own. So how do you know? You go to your doctor. Again, it's that trend. You got to get checked out. So if you have impotence, you don't want to be shy. You don't want to be embarrassed about talking to your doctor about it because it's a medical condition just like any other. Get checked out because it may be the first sign that you have high blood pressure, that you have diabetes, that you have something else, and then they can fix that and then the impotence goes away. But if they don't find any other causes, then a medicine for the impotence itself is definitely worth exploring, worth taking. And there are several different medicines, so if the first one does not work, talk to your doctor, try out another medication, see if they can find one that works for you. So I hope the men in the audience learned a lot, and I hope the women in the audience learned enough to try to prod the men in their lives to get to the doctor if they haven't been going and getting themselves checked out, because a lot of these issues are things that you want to get on top of when they're first getting started. It's not something that you want to wait 6 months, a year, 5 years down the road, especially if you're having symptoms that might be BPH but might be prostate cancer. You want to get checked to make sure that it's BPH and then we can fix it, or is it prostate cancer that we need to treat before it starts to spread to any other parts of your body and cause bigger problems. If you have any questions about anything you've seen today, and you want to contact me here at the station, you can do that. If you have any concerns about any symptoms that you may be having or any questions that relate to your specific condition, check with your primary physician. I hope you have enjoyed today's show. I am Dr. Alancia Wynn. Until next time, see you. Take care.